I'm just here today, just gonna give you guys a little overview, update on how life has been. Graduating from nursing school, working as a registered nurse out here in Las Vegas. I do night shifts, surgical suites, and I just started in the midst of COVID-19. So I think that'll be a little interesting story to let you guys know how it's been so far. Stay tuned. I can honestly say that the program that I did, it was a STAR-in program. So basically, I trained for 6 weeks prior to getting put into the hospital, just on my own. And I'm telling you, like, that training really helped so much, you guys. Like, it really helped me a lot. You know, they go through different, the EKGs, how to read heart monitors, different heart rates. You do CPR, you do codes. You learn how to put IVs in. You learn how to change PICC lines. You learn how to do heparin drip. You learn how to do all of that. It's amazing, you know, like things that you learn in nursing school, but it's like you're continuously doing it. You're getting checks off on it. And it's not a nursing school experience. Like in nursing school, you're tense, you know, like you have this instructor that's all over you and you just don't know what to do. Well, in this case, it's not like that. It's strictly, you know, they're just watching you do it and they guide you through it. You know, you feel comfortable. Your anxiety's not at all-time high. It was really, really helpful. So, you know, after that, you did the 6 weeks of training. It was like going to school all over again. But after that, you graduate and then you get put into the hospital. Well, guys, let me tell you, I started during COVID. So I kind of had, it was kind of like good and bad. The good thing was, our cohort was the last group of STAR-in training that they were doing. They shut it down. You know, we were at a casino at first training. They shut all the casinos down in Las Vegas, so then we had to go to a hotel and finish the rest of our weeks at the hotel. But after that, they like stopped interviewing people for STAR-in. They stopped put a hiring freeze down. So I really got blessed and lucky with that. Another thing is with the COVID-19, you know, like we're still trying to figure out how this virus works. You know, what is the transmission? How do you get it? Like, what can you do to stop it? How do we go about it working in the hospital? So I'm going into the hospital now, done, graduated, and I don't know what to expect. I don't know what's going on. I'm confused. I'm lost. But we also have a preceptor who is a nurse that we work under for 6 weeks too. So I trained on days with the preceptor, and she was amazing, guys. She was really, really good. She was too good. You know, she actually was a charge nurse as well. So some days, like, I would train with somebody else because she was charging, but she was on it. Her name is Kenya. She is like, when we're getting reports, she wants to know why this is happening. What is she's very detailed. She's like gonna make sure that she's covered and all her tracks are covered. She charts this, she did this because of this and why, you know? So that right there really just was like, wow. I want to be that nurse, you know, like I want to go home at night or in the morning and like be at peace and know that I did what I was supposed to do. And if anything else falls back, you know, like I'm covered, you know, I'm fine. So I had that preceptor and she really taught me a lot. And I'm going to be honest, you guys, starting off as a new nurse, you're going to feel like you went through nursing school for all of this for what? Like you're going to feel like you know nothing. I felt like I knew nothing when I walked in there. I came home some nights and I really questioned myself. Like, what? I went to school for this? Like, to still, you know, you're still stressed. The stress doesn't go away, you know, and I'm still new, so I don't know when it's gonna go away because I still stress when I come home, you know. So then I switched over like my last couple of weeks because I was training days and I'm working as a night nurse. So I'm like, you know, I don't feel comfortable just training days. I need to be trained during night shift because I know it's totally different. Let me tell you, it's very different. So different. You guys, I don't even know where to begin. Like, I love nights though, I will say that. But it's a less of a load, but not really. Because you think that your patients are asleep, but really, older people don't really sleep. And then, you know, people are in pain still. So it's like, you still have to give medicines at their due times. You have to wake them up. You have to still contact doctors. You still have to do the things you have to do during the day, but like, not like the food, and not like dealing with respiratory and therapy, you know, physical therapy, like speech therapy, like none of them are there. You don't have to worry about that. But night shift to me just fits me perfectly. If you're a night person, go for it. And you know, like, I don't know, some hospitals, they pay more. So I mean, that's a plus too, because think about it, you're up, I work, the shifts are from 7 p.m. to 7:30. Me, I'm extra, and I try to make sure that I'm on my game. So I get there around 6:20, because I want to look in my patient's chart, make sure that I have all the information down, make sure I know like what medicines I like to write. I'm very organized, so I like to write down like their medicines on paper. So like I put the times, separate the room numbers, the times, the medicines, things of that nature. It really helps me stay organized. You know, I'll go into detail about that later. I just really wanted you guys to know like where I am right now, my progress right now. So I've been on my own now for a little over a month, and it's crazy, you know, like, cause I remember the first day I'm like, wow, I'm really gonna be on my own. I'm not following a nurse anymore. Like, this is my patient by myself. But you guys, it's really, when you are precepted and you're trained the way you're supposed to be, it's really not that bad. And the thing that I love the most is that my colleagues are so helpful. You know, everybody, even the ones who didn't precept me, like they're always, Nisi, are you okay? You need anything, let me know. Like, they're very helpful. You know, IVs, I'm a hit and miss. I'm not gonna lie. Like, it's hard getting older people's IVs for me. You know, it's like you get it, you're in, and then you shoot that normal saline and it blows. And I'm like, you know, okay, I'll try one more time. After that, I'm not gonna keep poking. Like, I'm calling somebody. I call a nurse who I know is good and will get it. Don't be afraid, you guys, to ask people for help. Ask your colleagues, ask your coworkers, ask the charge nurse. Ask them. That's what they're there for. You know, it's a teamwork. It's a team effort. You know, like at the end of the day, it really is. And it's important for you to connect with them. And CNAs too, like, you guys, I love my CNAs. It's important to have a relationship with your CNAs. Don't take advantage of it, you know? If you're in the room and your patient has to use the restroom, help them. Like, I hate people who, you're not about to do anything, you have the time, you're just that, like don't be that nurse. Don't be that nurse. I'm telling you, you know, like, your CNAs will respect you more and they'll have your back. I'm telling you, my CNAs have my back. You know, like, I make sure that I scratch their back, they scratch mine. You know, that's what it is. It's a teamwork at the end of the day. You know, you want to still have that, you still need to delegate to them though. You know, like, if you're busy, tell them, like, I'm doing this, can you go get these vitals? You know, can you go change this person? Can you do this for me? Like, you still need to delegate too, because you're not going to be able to. I'm telling you, I'm sorry. You're just not going to be able to bathe a patient, change a patient, give patients meds, help a patient up out the bed, you know, admit patients, discharge patients. You're not going to be able to do all of that in the midst of, you know, one shift. Like, it's not going to happen. But, you know, the only thing I would say with COVID going on right now is the masks. You guys, wearing that mask all day, I can't breathe. Like, I don't know. You know, like, and I understand it's for the safety. We have to do it. It is what it is. Suck it up. I'm sorry, you guys. I'm about to make tacos and I keep touching this meat. But, you know, suck it up. Protect yourself. I'm telling you guys, protect yourself. at all costs. Because COVID is real. It's really, really real. Thank God I'm blessed that I work in a new tower, a new unit, and I deal with patients who just came back from surgeries. So we don't have COVID patients on our units. They're not allowed on our units because patients who just come from surgeries are more susceptible to infections and etc. So, we try to keep them away from them, isolated from anybody who has different infections, airborne diseases, etc. So I'm blessed and thankful for that I don't have to deal with that, because I do hear other people who do have to work with COVID patients, and like some nurses will get floated to the COVID units, and it may just be to turn a patient who's on a ventilator, or they may need somebody helping the COVID nurses. It's serious, it's everybody's body reacts to things differently. So somebody may have a mild case of coronavirus where they just have minimal symptoms like coughing and they don't have to go to the hospital. And then there's those who had to be admitted, and couldn't breathe on their own anymore, and they needed ventilating support. And it's sad, I really pray that somehow we can find a way to bring the curve down, because I don't know. So I'm just starting this, so I don't know. If you guys have questions or anything, let me know. I would be more than happy to answer your questions. This is just the beginning, you guys. I have a lot to talk about with you guys, a lot of different things that I want you guys to see in this journey, because it's really exciting, like you go to nursing school, you're struggling all this time, stressing, trying to learn how to save somebody's life and take care of somebody. It's rewarding. I love when I can go to work and a patient is like, they don't want you to leave, and they just thank you, and they're really grateful, and they're really they really, 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 really admire you, for helping them and taking care of them. And it's just something that it feels good in your heart.